Hello, my name is Nurse Engee. This topic is diabetes insipidus, the silent fluid imbalance. Let's look at the pathophysiology. When we hear the word diabetes, most of us think of blood sugar. But there's another condition, quiet, often misunderstood, that has nothing to do with glucose. This is diabetes insipidus, a disorder of water balance. Diabetes insipidus occurs when the body cannot properly regulate fluid balance. This happens due to a problem or insufficient production of antidiuretic hormone, ADH, by the pituitary gland. ADH helps the body retain water. Without it, the body loses excessive amounts of fluid through urine. So, what is antidiuretic hormone? In a healthy body, ADH signals the kidney to conserve water. But in diabetes insipidus, this signal is either absent or ignored. The result, large volumes of diluted urine and increasing dehydration. When our body produces ADH, we retain water. But when we lack ADH, we urinate more frequently and excessively. There are two types of diabetes insipidus. First is central diabetes insipidus. Antidiuretic hormone is made within the hypothalamus and secreted by the pituitary gland. When there is disorder of the pituitary gland, such as from a tumor or trauma or surgery or ischemic encephalopathy due to stroke, we can get a reduction in the amount of antidiuretic hormone that is secreted into the bloodstream. Second one is the nephrogenic diabetes insipidus. This is due to antidiuretic hormone resistance by the kidneys and is often from external cause, such as chronic lithium use, hypercalcemia, or a hereditary or genetic condition. What are the clinical features? The most obvious clinical manifestation for diabetes insipidus is polyuria, excessive urination. The urine is pale and diluted. As fluid is lost, dehydration begins to develop. Clients may experience low blood pressure, rapid heart rate, or diminished peripheral pulses, dry mouth or mucous membrane, and even insomnia due to frequent urination at night. The client may develop insomnia if that bladder keeps filling up. It's going to be very difficult to stay asleep, as they are going to have to get up multiple times at night to relieve themselves. Certain laboratory values are going to be anticipated. For example, the lab findings reveals important clues. There will be increase in the serum sodium level, that is hypernatremia. When we have decreased ADH, we are going to be urinating a lot of free water and retaining a lot of sodium. So that sodium level is going to be what? High. Because the sodium level is directly related to the serum osmolarity, that serum osmolarity will also be what? Increased. We also would expect to see decreased urine specific gravity and the serum ADH level. Now the serum ADH level will be decreased because it comes to central diabetes insipidus, whereas that level may be normal in clients with nephrogenic diabetes insipidus. What are the nursing interventions? Treatment depends on the type of diabetes insipidus. For clients with central diabetes insipidus, we administer desmopressin, which is a synthetic antidiuretic hormone. Again, with central diabetes insipidus, we have that decrease in the amount of antidiuretic hormone. Therefore, when we replace antidiuretic hormone, we are going to promote renal water reabsorption as well as reduce urine output. Because levels of antidiuretic hormones are adequate when it comes to nephrogenic diabetes insipidus, this treatment option is not effective. For both types of diabetes insipidus, fluid replacement is essential. Most of the time, hypotonic IV fluid replacement therapy helps to restore hydration, reduce sodium levels, and correct imbalances. Something like 0.45% sodium chloride is one of the hypotonic solutions that we can anticipate. This will help us replace fluid loss as well as restore plasma osmolarity and reduce serum levels, sodium levels. Nurses play a critical role in the intervention of diabetes insipidus. Monitoring intake and output is very essential and effective in the treatment plan. Monitoring and checking daily weights and assessing urine concentration are simple actions that can make the difference between stability and life-threatening dehydration. Diabetes insipidus may be silent, but its impact is powerful. With early recognition and proper care, balance can be restored. That's the end of this topic. See you next time.